Assalamu alaikum everyone. This is Mohammed Nafis and today we will discuss about gastroesophageal reflux disease and peptic ulcer disease. This is our topic that we discuss our slides today. So we will move to the next slides. The learning objective of our topic. First of all, define gastric esophageal reflexive disease and peptic ulcer disease. The next one, explain causes and risk factors. The third one is describe pathophysiology. The fourth one is recognize symptoms. And the last one is discuss diagnosis and management. This is our learning objective that we cover our slides today. So now we will move to the introduction part. This is the introduction, gastroesophageal reflexive disease and peptic ulcer disease. We mentioned GERD and PUD are common acid-related gastrointestinal disorders that affecting quality of life. This is the introduction. Now, definition of gastric esophageal reflexive disease: chronic reflex of stomach contents into the esophagus causing symptoms and mucosal injury. This is the definition of gastric esophageal reflexive disease. Now we will move to the next slides. Causes and risk factors of gastric esophageal reflexive disease: weak LES, obesity, pregnancy, smoking, alcohol, fatty foods, and hiatal hernia. This is a common causes and risk factor of gastric esophageal reflexive disease. Here is the pathophysiology of gastric esophageal reflexive disease. Earliest relaxations, acid reflex, then mucosal irritation, and then inflammation. So that's the pathophysiology of gastric esophageal reflexive disease. So the clinical manifestation of gastric esophagus reflexive disease is heartburn, so regurgitations, chest discomfort, cough, hoarseness. This is the clinical manifestations. So now diagnosis of gastric esophagus reflexive disease that we cover to the next slides. We will go to the next slides now. Here is the diagnosis of gastroesophageal reflexive disease, the clinical history, endoscopy, pH monitoring, barium swallow, and manometry. So, uh, when we diagnose the gastric esophagus reflexive disease, we will go all of these: clinical history, and endoscopy, and etc. The treatment of gastroesophagus reflexive disease: lifestyle changes, antacids, H2 blockers, PPIs. These are the treatments. Now we will move to the pharmacology of gastroesophageal reflexive disease drugs. Pharmacology of gastric esophagus reflexive disease drugs: antacids, H2 blockers, PPIs. So H2 blockers, famotidine, and PPIs, omeprazole and pantoprazole. So these are the complication of gastroesophageal reflexive disease: esophagitis, ulcers, strictures, and Barrett's esophagus. So first we study the gastric esophagus reflexive disease. Now we will move to the definition of peptic ulcer disease: ulceration of stomach and duodenum due to acid mucosal imbalance. This is the definition of peptic ulcer disease. Here is the causes and risk factor of peptic ulcer diseases: H. pylori, this is bacteria, NSAID, smoking, and alcohol. That's the causes and risk factor of peptic ulcer diseases. The pathophysiology of peptic ulcer diseases increase acids plus reduce protection that will goes to the ulcer formation. So when ulcer is produced, then peptic ulcer produced. Clinical manifestation of peptic ulcer disease: burning epigastric pain, nausea, vomiting, bloating. This is the clinical manifestation of peptic ulcer diseases. Diagnosis of peptic ulcer disease is endoscopy, breath test, stool antigen biopsy. This is the diagnosis of peptic ulcer diseases. Now we will move to the pharmacological management of peptic ulcer diseases. We will go to the next slides. Pharmacological management of peptic ulcer diseases: antibiotics, PPIs, and sucralfate. I already mentioned before the H. pylori. This is the type of bacteria. So the triple therapy for H. pylori: PPI plus amoxicillin plus clarithromycin. So these medicine will give 10 to 14 days for its cures. Complications of peptic ulcer disease: bleeding, perforation, obstructions, anemia. These are the complications. If we will see the comparison of gastroesophageal reflexive disease versus peptic ulcer disease, so gastroesophageal reflexive disease, esophagus reflex, heartburn, and peptic ulcer disease, stomach, duodenum, ulcer pain. This is the comparison of GERD versus PUD. The prevention is healthy diet, avoid smoking, treat H. pylori, and limit NSAID. Prevention of peptic ulcer diseases. These are the preventions. Now we will go to the goes through the conclusion. Here is the conclusion: early diagnosis and proper treatment reduce complications. These are the references. Uh, I'll take the material for pharmacological textbooks and clinical guidelines. So this is the end of our topic. I hope everyone will easily understand. Thank you so much.